Stay tuned to hear a quick summary of the latest anti-obesity medications and their costs. Hi, and welcome to another edition of Your Health with Dr. Christy. My name is Dr. Christy Reisinger, and today we're going to take a quick look at all of the anti-obesity medications that are currently available on the market and those that are coming out soon, how well they work, and what their price is. Okay, let's start with the most effective anti-obesity medication on the market, and that is tirzepatide, also known as Zepbound when it's used for obesity, or Mounjaro when it's used for diabetes. So this medication is a weekly injection, and studies have shown that on average, patients that use tirzepatide lose about 20% of their total body weight. Currently, patients can get this medication directly through Lilly Direct and pay cash. The initial starting dose of 2.5 milligrams is available for $299, and then all other doses are available per month for $449. Still very expensive. Next up is Wegovy, and now they have weekly injectable forms of this medication as well as a daily pill. Wegovy is also known as semaglutide. Patients that use this medication tend to, on average, lose about 15% of their total body weight. The lower two doses of the injection cost about $199 per month, and then it jumps to $349 per month. The pills start at $149 for the lower two doses and then jumps up to $299 for the upper two doses. The next most effective medication I think that's on the market is a medication called Qsymia, and it's a combination of phentermine and topiramate. Patients on this medication tend to lose about 10% of their total body weight. This medication is available through a direct-to-consumer pharmacy for $99 a month. So you can get 30 pills for $99 a month. Then there are three more medications that I think tend to work about the same. The next is bupropion, which is also known as Wellbutrin, topiramate, which is also known as Topamax, and then also Saxenda, which is an injectable daily medication. All three of these medications, patients tend to lose about 7% of their total body weight. Bupropion and topiramate are very inexpensive. Saxenda, also known as liraglutide, I don't really prescribe that very often because I figure if you're going to do an injection, why not just do the more effective injection of the once a week? Next up is Contrave, which is a combination of naltrexone and bupropion. This medication's been on the market for a long time. Patients tend to lose about 6% of their total body weight with this medication. This is another oral medication that you take daily, and there's another direct-to-consumer option with this medication, and you can get 30 pills for $99 a month. And then lastly is phentermine. Phentermine is actually the most widely prescribed anti-obesity medication worldwide because it's so inexpensive. Even patients, when their insurances refuse to cover this medication, pay about $25 to $30 a month for this medication. On average, patients tend to lose about 5% of their total body weight. And at the end of the day, there are lots of pros and cons with each one of these medications. I would say that the GLP-1 medications like Zepbound and Wegovy have the fewest long-term side effects and the most long-term benefits. There are two new products that should be coming out sometime in 2026. The first is orforglipron, which is a daily pill. And with this medication, patients have lost about 12% of their total body weight. We don't have a lot of information on pricing, but I would imagine that they'll try to price match the oral Wegovy pill. And then lastly, the one that I'm most excited about is another weekly injection called retatrutide. Patients on this medication have lost about 24% of their total body weight, and there have just been some really great outcomes with it. So I'm excited to see that one come out. We have no indication on pricing on this injectable medication. I think at the end of the day, it's important to realize that medications have limits, and on average, these medications help patients lose a certain percentage of their body weight. Patients still must be in a calorie deficit in order to lose weight. I hope that's helpful. I do think prices will continue to go down as more and more options come on the market. Thank you for joining me.